medical community taking a closer look at how we can prevent everything from head concussions in football to life-altering strokes. With us now is Dr. Ali. He's going to tell us more about this, what we need to know. Dr. Ali, thanks so much for being here.
Thanks so much for having me here.
So when we talk brain injuries, what are we really talking about?
Almost everything, from the simple concussion that you can get when slipping on a rug at home to a biking accident or major traumatic brain injury. Also stroke, the two types of strokes, something that's called like a brain hemorrhage or a stroke where the part of the brain doesn't get an adequate blood supply.
And brain injuries can be life-altering, so it's really important for people during months like this to learn more about them, right?
Absolutely, and I get a lot of questions about concussions, but I also want to stress about stroke. A lot of people don't realize you can really prevent the damage from a stroke if you recognize it early. And I'm sure everybody has heard of, sudden weakness, slurring of the speech, call 911, but something people don't really realize, the subtle signs. Vision problems. If you start seeing double vision, if you see a little black curtain in a part of your visual field, these are symptoms that people don't associate with stroke as much as sudden weakness or slurred speech. So those are important symptoms that I want people to know that you should not ignore, and you should immediately call 911.
Okay, so that's good to know. And it doesn't necessarily happen in an instant, right? This could happen over a period of time?
Well, the blurry vision and the double vision does happen suddenly.
Oh, okay.
So if it's over a gradual course of time, it's less likely an acute stroke. It could be, however, what we call a transient ischemic attack. That's also very important because sometimes you can get a symptom that suddenly gets better and you're like, oh, I'm fine now. But then later on, it becomes the real stroke. So that's also a telltale sign. Still call 911 or actually go to your emergency room if you are finding that your symptoms have subsided, because it could mean that it is a symptom of maybe a larger stroke coming on.
Okay, all important to really know because in the moment you want to act fast. Absolutely. Now, let's talk about concussions. A lot of people who play football, the two are correlated, and helmets don't really prevent them.
It doesn't, and if we see the graphic here, we can see that the brain is actually sloshing back and forth in the skull. So when you're wearing a helmet, and they study this, it's the force of the head going back and forth. And we also see this when you slam on the brakes of the cars, because you get that whiplash, and the brain can get bruised when it hits the front and the back of the skull. Now they're looking at maybe helmets which are designed differently, where they have a soft outer layer which can reduce the amount of force. It's all physics that allow the brain to go back and forth when you have impact. But the issue is, if you do have impact, don't just brush it off and say, Coach, I can go back and play. The NFL has a very clear protocol for concussions, and now we're learning that the biggest thing you can do is to get off the playing field, get rest. And also, interestingly, they're finding out that avoiding blue light, avoiding screens, avoiding excess stimulation for 24 to 48 hours is essential for you to recover from that original blow. Now, we are seeing, as just yesterday, a study came out in the American Academy of Neurology showing that college athletes with a concussion, even 1 year later, on the MRI, they found that same brain bruising injury.
Wow.
And, this kind of brain fog, this emotional, depression, or something off with the personality, it's something that you shouldn't really ignore. It could be a part of that original concussion. And now neurologists are paying attention, and there are treatments for it.
Okay, this is all really important to know. Now, as we wrap up here, brain injury awareness, what's the biggest takeaway for our viewers at home? Not everyone plays football. They might not be at risk for a stroke, but it's important because it could happen to anyone.
It could happen to anyone. And I want to stress that everybody thinks of concussions as happening in sports. We see concussions in all kinds of people. And as a geriatric physician, I see them in my patients who fall in the bathroom, fall in the tub, or a simple fall can cause it. So that's very important to know.
All right, well, Dr. Ali, we appreciate your time as always. Really great tips, bringing awareness to brain injury. Thanks so much, and we'll be right back.